It is my pleasure to welcome all of you to our panel on global access to vaccines. My name is Ayala Berman, and I lead the program on global health and governance at the Center for International Law at the National University of Singapore. Singapore and Switzerland have taken on leadership roles with respect to global access to vaccines. A couple of months ago, they joined forces and now co-chair the Friends of the Covax facility, a body which works on advancing access to vaccines in low and middle income countries. So against this background, we're absolutely delighted here at the Center for International Law to be collaborating with the Swiss Embassy in Singapore and to be co-sponsoring this panel on global access to vaccines. I'm equally delighted to have an excellent panel here with us today, which I'd like to introduce you to. Ms. Martina Schwab, hi Martina, who's co-head of the Global Health Section in the International Affairs Division of the Swiss Federal Office of Public Health. Mr. Lionel Yee, who's Singapore's Deputy Attorney General. Professor Prabhash Ranjan from the Faculty of Law at the South Asian University. Hi Prabhash. And Professor Suri Moon, who's with us from the Graduate Institute in Geneva and also co-directs the Global Health Center there. Hi, Suri, very happy to have all of you here. For their full profiles are available on the Center for International Law website. Please note that if you have questions in the course of this session, then you're very welcome to type them in. At the bottom of the screen, you have a Q&A section, and we'll address those at the end of the session. You also have a like function, so to like your favorite questions. So without further delay, I am delighted to invite His Excellency Ambassador Fabrice Fillier and the Director of our Center, Dr. Nilofer Oral, to give their introductory remarks. Your Excellency, please, the screen is all yours.
Thank you, Ayelet. Good afternoon, Singapore, and good morning, Switzerland. I'm very pleased to be part of this webinar today on global access to COVID-19 vaccines, which the NUS Center for International Law have organized today with our embassy in Singapore. This event could not be more timely. As you know, Singapore and Switzerland have co-chaired the groups of Friends of the Covax facility, accompanying since last summer the setting up of this unique multilateral instrument led by Gavi, CEPI, WHO. From our embassy's perspective, this is a great opportunity to work hand in hand with our host country, Singapore, with which we have excellent bilateral and multilateral ties already. Let me first commend the strong commitment and the tireless work of my country of residence. Singapore, its Ministry of Foreign Affairs, and its remarkable High Commissioner to the UN in Geneva, His Excellency Umesh Bhatia, from the beginning on, have been instrumental in creating a sustained momentum for Covax. Let me say also a few words on multilateral processes on COVID-19, as they are, in the eyes of small countries like Switzerland and Singapore, paramount to address and solve any global issues. Among the UN member states, the COVID-19 response has been widely discussed in different fora. Let me mention a few resolutions adopted recently. A few weeks back, the Security Council unanimously adopted a resolution demanding a sustained humanitarian pause in all conflict areas to enable coronavirus vaccine access. This very first intergovernmental statement from the UN on COVID-19, however, was a resolution adopted by the UN General Assembly. The text with the title, Global Solidarity to Fight the Coronavirus Disease 2019, had been launched by Singapore, Switzerland, and 4 other countries, and was a big success, with almost all UN member states having co-sponsored the text. The resolution expressed the hope that the pandemic can be mitigated and successfully tackled through leadership and sustained global cooperation. Almost a year after the first UN resolution on the pandemic, the crisis is far from over. UN Secretary General Antonio Guterres, who has taken a strong leadership role to mitigate and reverse the crisis, recently spoke out a dire warning. If the virus is allowed to spread like wildfire in the global south, it will mutate again and again, which will prolong the pandemic, significantly upending lives, destroying economies, and widening the sustainable development goals, exacerbating all the factors which drive the economy. Luckily, other important multilateral fora have also joined forces to combat the COVID-19 crisis. Mid-February, for example, the G7 also made a statement and doubled his contribution to the Covax facility. Switzerland is among the donors of the Covax facility and is supporting all organizations working under the Covax facility. In our region, Southeast Asia, the Covax initiative is highly important and ASEAN is set to receive 32 million doses of COVID-19 vaccines through the Covax facility by the end of 2021. Our host country, Singapore, is a steadfast promoter of Covax, and its Singapore Changi Airport is well positioned and equipped to become the coronavirus vaccine distribution hub for Southeast Asia. It has become clear that the vaccines against COVID-19 and the access to them are at the very heart of fighting the odds in this crisis. Switzerland is committed to finding a truly global solution for equitable access to COVID-19 vaccines in all countries. We, as Switzerland, are proud to contribute to it, together with Singapore, by supporting the Covax initiative, which WHO Director General Tedros recently described as an unprecedented partnership that will not only change the course of the pandemic, but will change the way the world responds to future health emergencies. With this, I give the floor back to the panel and wish you a fruitful discussion. Thank you.
Thank you very much, Ambassador. Please, Nilofer, to you.
Thank you. Thank you so much, Ayelet, and thank you, Ambassador. Well, as Director of the NUS Center for International Law, it is my great pleasure to welcome all of you who are joining us from different parts of the world and different time zones. I also welcome our panel of outstanding speakers and thank them for being with us today. In addition, I'm very grateful to Ambassador Fillez and the Embassy of Switzerland for co-sponsoring this panel on a topic the importance of which cannot be overstated. And of course, I thank CIL's very own Dr. Ayelet Berman, who is the lead of the CIL Global Public Health Program, and of course, thanks to our events manager, Jerry Ng. Now, nearly 1 year ago, the Center for International Law launched a series of online panels looking at different aspects of the pandemic in relation to international law. Now, here we are, 1 year later, we are still grappling with the complex challenges the pandemic has posed at so many different levels and covering virtually every aspect of our lives. During this past year, we discovered just how unprepared countries were for the pandemic, and surprisingly, in particular, the developed world. We discovered the fragility of the multilateral system of international relations and law constructed so painstakingly over the decades. We discovered the lack of cooperation, coordination, and solidarity in facing a monumental and historic challenge to the economic, social, and global infrastructures. However, an important difference from 1 year ago is that today we have not one, but a variety of vaccines. However, as we worried some months ago, access to these vaccines has proven not to be equal for all countries, and distribution has proven to be extremely difficult. For this reason, the Covax initiative is core. It is so important to ensuring equitable access to vaccines by all states, and in this way, Singapore and Switzerland are to be congratulated. As Ambassador Fillez said, this panel could not be more timely to explore the multifaceted challenges of getting the entire world effectively vaccinated. As the COVID-19 virus mutates into different variants, the challenge is further exacerbated. It is critical that all parts of the world, all segments of communities have access to effective vaccines in a timely manner. So thank you all, and I also look forward to this discussion. And again, back to you, Ayelet.
Thank you very much, Nilofer. So with that, let us open the discussion. I think if you look at vaccines, it becomes quite clear that science has been amazing. So within 1 year of the pandemic, we actually already have several vaccines which have been approved, and I think that's gone beyond expectations. So that part has worked very well. The second part that we are now struggling with is the question is, how do we distribute these vaccines rapidly and in an equal and fair manner to people around the world? So as Dr. Tedros, the Director General of the World Health Organization, has said, to end pandemics, vaccines don't end pandemics, it's vaccinations that do. So that's really the challenge that is before us now. How do we distribute? How do we get these vaccines to the people? And here, especially in low and middle income countries. And the purpose of this panel is really to look at this question from an international law and governance perspective. And I think what we aim to do in this panel is to address three main issues. First of all, to highlight and to address what the main barriers are to that currently. That's one thing. And then to discuss the main initiatives that are currently underway to address this problem. And then the third question we'll try to address is, going forward, how should things be improved? What should be developed? Because unfortunately, all the experts are telling us it's most likely that we'll have another pandemic in the future. So these are things we'll need to be thinking about. So with that, I'd like to begin with the issue of vaccine nationalism. I think I'm pretty sure all of you have heard the term. It appears quite frequently in the media and also in the scholarship. It's really one of the main barriers to global access to vaccines. And with that, what is meant is that essentially high-income countries are buying up most of the vaccine supply from pharmaceutical companies, the result being that vaccines are not available to low-income countries because they can't compete, of course, with the prices, and also the supply remains low. So with that, Lionel, I'd be happy to turn to you and ask you what your take is on this issue of vaccine nationalism, and what do you think drives it?
Oh, thank you very much, Ayelet, and thank you also to the Center for International Law and the Swiss Embassy for organizing this roundtable. Maybe before I respond to your question, I should just preface by saying that the views I express here are really those expressed in my personal capacity. I'm a lawyer. I'm not a doctor, and I'm certainly not a public health expert. The question of vaccine nationalism and what it is, I think vaccine nationalism is probably best epitomized by what happened in 2009 when there was the H1N1 pandemic. And at that time, essentially, all the high-income countries snapped up all the H1N1 vaccine doses. And there were some that even put in place measures to prevent the export of doses manufactured within their borders. So that's really, it's kind of like captures the essence of what vaccine nationalism is. And what drives this? I think two things. The first is a situation where clearly demand exceeds supply. And that, I think, usually happens in the initial stages of a pandemic, or the initial stages of the introduction of a vaccine to deal with a disease. When in the meantime, well, you have people who, everyone wants the vaccine, but in the meantime, I think supply is still being ramped up. And then everyone tries to get their hands on the vaccine, and those obviously with the means of to do so are obviously in a better position to get their hands on the vaccines. And I think the second factor that drives vaccine nationalism is the fact that we all live in a world which is made up of sovereign states with governments who have a duty to look after the populations that they govern and to whom they are accountable in one way or another. Back to you, Eileen.
Thank you very much. So, given that it's the current state of how things are happening, and there's so much criticism of this, in your opinion, addressing vaccine nationalism, is it just a moral imperative because of this inequality caused, lack of solidarity among the countries, the states in the world, or is it actually in the interest of high-income countries to get other countries vaccinated? So how should we look at this issue?
Well, I think it's both, in fact. So it's not merely a moral matter in the case of COVID-19 vaccines. I think the ambassador has just said that, referred to global solidarity, and that's, I think, essential in this case for an international response to be successful for everybody. Our Prime Minister in June last year coined the term vaccine multilateralism as a kind of counterpoint to vaccine nationalism. Certainly, I think for Singapore, being globally connected and so dependent upon international trade, international movement of people and so on, we certainly have a very clear interest in the notion of access to vaccines for all, because this is going to take us back to a much greater level of normalcy. And I mean, as the saying goes, no one is safe until all are safe. When I was preparing for this roundtable, I asked myself, is that really the case? Because I mean, for Singapore, it's fairly evident. But I suppose there could be countries that simply close all their borders and are fairly self-sufficient. But having reflected, and I think it's in fact emphatic, yes, it is the case. And it's for, I think, two reasons. The first is because we all live in an interconnected world. And it's become more interconnected over the years, in fact. And I think almost all economies, to some extent, rely on some form of cross-border movement of people, of services, of goods. I think even some of the most insular countries around still rely, for example, on tourism for a part of their revenues. That's the first reason. The second reason is what I think both the ambassador and Nilofer have just alluded to, and that is the reality that the longer the pandemic remains at large and continues to spread in communities and populations, it's going to continue to mutate. And with every mutation, it sort of brings it perhaps one step closer to a variant that the current set of vaccines we have cannot address. So I think it's a clear-cut case of both a moral imperative as well as self-interest on the part of everyone to do that part.
Yes, absolutely. I could not agree more with what you just said. We've kind of discussed this kind of at a conceptual level now, kind of this issue of vaccine nationalism. But what do you think? Where do we actually currently stand in terms of equitable access?
Okay, looking at it from the perspective of maybe the past decade or so, I have to say that I'm actually quite heartened that we have moved quite some way away from what happened in 2009 and to a much, I think, greater degree of vaccine multilateralism. It's actually quite a paradigm shift, I think, from the way that the international community has approached vaccine access in the past. Of course, I think no system is perfect, but I would say that if you look at things in the whole, I think the progress that has been made so far has been encouraging. I think if we just cast our minds back exactly a year ago, on the 10th of March 2020, we were actually dealing with a virus that was causing chaos and huge casualties, for which actually there's fairly little knowledge of, including on issues of how it spread or the extent of asymptomatic spread. And if you also take into account the fact that vaccine development is a very resource-intensive exercise, and it's got many, many uncertainties. And yet, I think today, barely a year since the outbreak of the disease and the sharing of the genetic information by the Chinese scientists, we have actually developed not one, but several vaccines. That's in a way a record time as far as vaccine development is concerned. Some of these vaccines are using messenger RNA technology, which is pretty cutting-edge technology, and quite a number have already been given emergency use authorizations in different jurisdictions, and vaccinations have started. Then there is Covax, and I'm not going to say too much about Covax because I think that's something you probably want to explore with other panelists who are better equipped to address this issue. But it's a collective effort to secure equitable access. And it's not only in place, but it's already, as of the end of last week, I think, delivered some 20 million doses of vaccines, and it's projected to deliver to the 92 lower and lower middle income countries that are covered by the what they call the Advanced Market Commitment scheme of Covax. Enough doses by the middle of this year to cover the frontline health care workers in these countries. And this is really on top of other efforts by states to widen vaccine access. States like China and Russia, for example, who have either donated or supplied on favorable terms vaccines to different states. And also, I think, pledges by the UK and others to share the excess vaccine supplies with others. On equitable access, I think one of the issues which I think we should not forget to discuss or to focus upon is the fact that I think equitable access is not just about interstate equity, but also I think intrastate equity. And I think this is beginning to become much more in the spotlight as vaccines are being delivered and then they have to be administered within countries. Because I think we're hearing, of course, stories in the media on people using privilege, for example, to jump the queue. And I think in the course of the last 24 hours, I read a report somewhere, I think it's a statement issued by the Red Cross that observed that though vaccines were reaching airports in various jurisdictions, they were not reaching the sort of remote communities within the countries. And so I think this is something that we just need to bear in mind, that when we speak of equitable access, it's both, I think, there's an interstate dimension as well as an intra-state dimension. Thanks.
Yes, absolutely. Maybe we'll have time to address that afterwards, also further in the question and answer session. Martina, I'd like to ask you, you work in global health as part of the Swiss government. So you deal with this, essentially, this issue of vaccine nationalism on a daily basis, or you see it up close, I would say. What is your take on this issue?
Thank you very much. And first of all, good afternoon, good morning to everyone in this webinar. Thank you very much for organizing it, and I'm very pleased to be here with you today. Thank you also to Lionel for the very good points you made before. I think I can share many of those. First, I would like to emphasize that Switzerland strongly believes in international collaboration, multilateralism, and solidarity to combat this pandemic. We have a duty to protect our population, and no one is safe until everyone is safe. So we need to work together. And this is why we're very committed to finding a truly global solution to the issue of purchasing and the equitable distribution of vaccines. So we've been very glad to work together with Singapore on the group of friends of the Covax facility. accompanying it, the setting up since the beginning last summer. But what I would like to say is that this multilateral way is new. It had to be created 1 year ago. It did not exist. And this is also what Lionel just said before. We had no existing mechanism to rely upon and that we could use right away. So I would like to say a few words maybe on what our mindset was 1 year ago when we started discussing about the procurement of vaccines. So it was a situation of high uncertainty. We were amidst the beginning of the pandemic. It was spreading all around the world. We had little knowledge about the virus, and we had to take containment measures. So it was clear that the best way to end the pandemic was to find a vaccine, but we did not know which technology and which vaccines would prove efficient and safe. And very importantly, we were speaking of a time frame of several years to develop a vaccine. So what has been achieved is really remarkable, actually. And in this context of uncertainty, Switzerland chose a diversified approach towards the vaccine procurement strategy. So we entered into bilateral talks with companies, with the European Union, and explored the multilateral way then with Covax. So it was really 3 elements of our strategy to diversify our approach. And finally, I would like to make a point on why bilateral agreements are important for the global solution. Because actually, when we enter into a bilateral agreement with a company, we pay reservation fees and upfront payments. And these payments are needed to finance the research and development of the vaccine candidates. And if a vaccine fails, we lose this money. Some of these vaccines, luckily, have been successful. They are now available on the market and also for Covax, and this benefits to all countries. So when we enter into bilateral agreement, we bear a significant risk of the vaccine development. And in the end, this contributes to the availability of vaccines for all. Back to you.
Okay, thank you very, very much. You know what, so we've just spoken about the bilateral agreements, which is really a point I hadn't thought about. So that's very interesting what you just mentioned about how that actually in the end also feeds it back into the multilateral access actually to the global access to vaccines. Let's move on to talk about Covax, which is really the main or only multilateral initiative which has been established for advancing access of low and income countries, vaccines to low and middle income countries. So as we've mentioned now a couple of times, Switzerland and Singapore are co-chairs of the Friends of the Covax facility. And I'd really be grateful if you could perhaps for our audience, talk about, first of all, how Covax works, what is the structure of Covax and how it actually seeks to achieve this goal of granting access to developing countries.
Okay, thank you. I will try to make it very simple. Maybe it's also oversimplified, but I would say that Covax is a mechanism for countries to join efforts and buy vaccines together. So they pool resources, they enter into negotiations with manufacturers as a group to buy vaccines together. So the successful vaccines are then distributed among the countries according to defined principles. The objective is to buy and distribute about 2 billion doses of COVID-19 vaccines by the end of the year, in all the participating countries. Technically, there are 2 parts. The one is the so-called Covax AMC, which was mentioned already before. This is the mechanism funded with ODA for the low-income countries. The other part is the so-called self-financing countries. These are middle-income countries and high-income countries that pay for their participation themselves. So when we started, it was really ambitious to have everybody on board, but the aim was really to buy a truly global solution from all countries for all countries, not only something for the developing countries or something only for the high-income countries, middle-income countries, but really something for where every country could join, every country who wanted could join efforts and work together to buy vaccines. And so we're very glad that today we have 199 countries participating in the Covax facility.
So would you consider it critical that we have some kind of multilateral initiative? So had we not had, you know, such a multilateral cooperation as Covax, would that be a problem? So do you really consider this critical? Also going, you know, if you think going forward, is this the way to go? This kind of Covax-like organization?
I think so, because this mechanism, it gives the countries, all the countries, the possibility to get vaccines. It's a truly global effort, common effort to address a common challenge. It's a terrific challenge that we're facing. So the important thing is that all countries can join and get vaccines for at least part of their population. And this is very important to combat the pandemic. It is a very effective way also towards a global distribution of vaccines. One advantage of Covax is that it pools resources from all participating countries and it centralizes the negotiations. So it makes it easier for countries to buy vaccines. And the other advantage is that it facilitates the support to lower income countries. It is one central mechanism that pools the donor contribution and distributes the vaccines amongst all participating AMC countries. If we had only bilateral donor contributions, they would benefit only a limited number of beneficiary countries each time. By pooling them, the vaccines can be distributed really equitably to all the countries that participate everywhere. And we define principles in order to ensure that. So we really believe that this contributes to an equitable access of vaccines.
Okay, thank you very much. So why then Switzerland, from what I understand, believes that you know, it's important as part of its strategy that other countries get vaccinated. So that is essentially that because, you know, none of us is safe until all of us are safe. Yeah. But is Switzerland also involved? Did it also get involved with Covax, like as a self-financing country? So could you also speak about that? Because you know, what is the logic for a country like Switzerland actually to join Covax, given that it has enough resources and can conclude bilateral agreements? So perhaps you could also speak a little bit about that, about what the rationale is for high-income countries to join not only as donors, but actually as potential recipients of vaccines through Covax.
Absolutely, and this is a very important part. So for us, we're participating as a self-financing country for ourselves, to procure vaccines for ourselves, for a maximum of 20% of our population, and as a donor to the Covax AMC for the lower income countries. So for us, participating as a self-financing country is an element of our diversified procurement strategy. Through Covax, we have access to a wide portfolio of vaccines, and it enables us to diversify our approach. Again, we were in a very difficult situation of uncertainty. We did not know which vaccine would work in the end. So we had to try all possible ways. And I think the multilateral way is really a very good complement also to the bilateral agreements and the other agreements. So, okay. For us, it was also important to participate in this mechanism in order to be able also to prepare for the future. I mean, as mentioned before, we did not have such a mechanism before, and now it's important to draw the lessons also from this initiative, and to see how we use such a mechanism, or how we prepare for the future with such functioning multilateral mechanism to rely upon also in the future.
Okay, so that's super interesting. So a country like Switzerland essentially also joins Covax as an insurance mechanism, given where it was at the beginning of the pandemic. Just out of curiosity, is Switzerland still expected to receive any vaccines now through Covax, or is that not going to happen now that the bilateral agreements worked out and actually through those bilateral supplies?
It's very difficult to say at this point because both processes are ongoing. So Covax is still negotiating agreements. The portfolio is not yet complete. There are only a few vaccines that are, or type of vaccines that are available so far. And the same thing also on our bilateral part. So it's really too early to say today how it will end up in the end.
Okay, super. Thank you so much. Suri, I'd like to turn to you. I know you've written a lot on these issues, and I'm really interested in hearing your take. In the past 2 weeks, we've seen, news that Covax has started rolling out vaccines, and we've seen last week they said they supplied to 20 countries, 30 million doses, and then this week they want to supply to 30 countries, 14.5 million doses. So, and also they say, the plan of Covax, as I understand it, is to provide supplies that would cover 20% of the population. So my question to you, it all sounds great, Covax, but does it really matter? Is it really going to be effective in achieving this goal of global access, or is it going to in the end be like, somewhat of a drop in the water?
Thanks a lot for the really great question. And I also wanted to just thank the Center for International Law and the Embassy of Switzerland for organizing this event and for the opportunity to be here. I think this is really one of the most critical issues facing the global community this year and in the future. And for me, I think, like many of us who are here today in the panel and in the audience, I think these first images of vaccines arriving in Ghana and in Cote d'Ivoire was a very exciting moment. I mean, this was really the realization of, as Martina said, a initiative that was brand new and was just an idea really just one short year ago. So that, I think we cannot deny that this is a really important moment and precedent for the global community. I also think that in terms of big successes that Covax has achieved, the degree of political support, almost pretty much every country has joined and supported the initiative in some way. I think that is a hugely impressive political accomplishment. And this is really important when we think about what kinds of initiatives can we imagine for the future, that this is a foundation upon which we have to build. And it's not only money, we've mentioned the importance of donor funding, but it's really not only money, it's political leadership that was essential for getting Covax off the ground. And I think that the role that Switzerland and Singapore played as friends of Covax was really crucial in building this political momentum, certainly in the early days. I do think that we have to recognize, of course, as you've pointed out, Covax is only hoping to cover 20% of the population. We know that's far below the levels needed for population immunity, which are estimated at around 70%, maybe even more than that. And that in reality, I think what we'll see in the next couple of years is that it is a insurance policy indeed. As Martina has described it, it's a baseline insurance policy. It will be very important for some countries and probably much less important for others. And so I think the grand vision of a central global initiative that could really meet the needs of all countries, I think that is still far from the reality that we're going to be facing in this year and in the coming years. But I do think that one of the other big successes has been that when we think about the rule of the jungle, right? When we think about how most countries have used every means at their disposal to get access to vaccines, using money, using political influence, using diplomatic ties, using industrial power, what Covax has done is injected an element of ethics and rationalism in terms of allocation of supply, and public health principles, trying to get vaccines to everywhere where we have cases, everywhere where we have vulnerable individuals. And I think that is something that is very hard to do in the middle of this sort of law of the jungle. And so I think one of the big questions is, what can we do so that we have more rule of law in the future, so that we're not, in fact, seeing a multilateral initiative struggling, sort of trying to compete oftentimes with its own countries. It is competing with its own countries and its own supporters for access to vaccine supply. And I think that has really been a major, major challenge in delivering on its objectives.
Fantastic, super. Thank you so much, Suri. I'd like to move on to another issue. So we've talked about vaccine nationalism and how Covax tries to deal with that. Another major issue, which has been creating a barrier to vaccine access, is the issue of production. So the fact that pharmaceutical companies, most of them are in high-income countries, and they're producing the vaccines there. And so we have a problem of supply of vaccines. In theory, or that's what some countries want to advance, developing countries, so manufacturers in developing countries could, copy these vaccines and produce them within their manufacturing facilities in developing countries. And that would, of course, because we have a lot of available manufacturing capacity facilities, and that would open up, totally increase the supply of vaccines, and then we could distribute them. Of course, from a legal perspective, the main issue there is the issue of intellectual property rights, of patents, because of course they could be sued for that, including under the TRIPS WTO agreement. So this is really where I'd like to turn to you, Prabhash, because you've been following very closely what has been going on in the WTO. One of the efforts, a major initiative that has been put forward by India and South Africa, has been essentially to reach an agreement before the WTO among member states to waive the TRIPS agreement, so that states, could do, as I just mentioned, without fear of being sued, that claims be brought against them under the TRIPS agreement. And I'd really be and today and tomorrow, actually, there are discussions taking place at the TRIPS Council at the WTO. So Prabhash, I'd really be happy if you again could, elaborate for our audience, first of all, what is actually, what the problem is in terms of IP and the WTO, and what is currently taking place, and what your take is on that.
Yeah, thank you so much, Ayelet. I'm extremely grateful to Center for International Law and to the Embassy of Switzerland for this kind invitation, and very happy to be part of this terrific panel. To sort of put this in simple words, I'll say that the problem is, again, because of unequal manufacturing capability. So we have certain countries where these vaccines have been developed because they are leaders in technology. They are home to these giant pharmaceutical companies which have developed these vaccines. The scientific development is very high. But on the other hand, we also have a large number of countries in Asia, Africa, Latin America, etc., which do not have this kind of manufacturing capability and scientific advancement. And so the question is that if we want to increase the accessibility to vaccines, then we need to overcome all the impediments that may come along. And intellectual property rights would definitely be one of those factors. And it is in this context that India and South Africa have made this proposal at the WTO to waive certain provisions of the TRIPS agreement in order to ensure that intellectual property rights do not become impediments in ensuring the wider accessibility and distribution of vaccines. Now, from a legal point of view, the question is that within the WTO legal system, is there a possibility of such a waiver? The answer is yes. If we look at Article 9 of the Marrakesh Agreement establishing the WTO, it clearly provides that in exceptional circumstances, such waivers can be given. There is a precedence for this as well. In 2003, such a waiver was given in case of the spread of AIDS disease in Africa. So there is a clear precedence for this as well. So the WTO legal system as such is not an obstacle. But what is an obstacle in this regard is some of the developed countries are not very supportive of granting this waiver. And again, this could be because these developed countries are homes of these giant pharmaceutical companies who have developed these vaccines. And they fear that if this waiver is granted, then it will become easier for a large number of generic manufacturers, especially in countries like India, to manufacture these vaccines and then profit from the R&D and from the development that these companies have undertaken. But on the one hand, this commercial interest, and then on the other hand, we have the larger concern of ensuring accessibility to vaccines. Some people argue that this waiver is to be given only in exceptional circumstances. And the answer to that question is that if a global pandemic once in a century event is not an exceptional circumstance, then what will be? So this is surely a case where such a waiver can be granted. There is a legal provision for this as well. But then any international organization is as good as its member countries want it to be. And therefore, it's truly a question of leadership at the WTO, whether all countries can come together and agree for this waiver or not.
I'd like to ask you I mean, one of the issues that have been raised in this context is why at all do we need a waiver? Because essentially we already have under the Doha Declaration flexibilities for the TRIPS agreement. So why would that not be enough actually? I mean, because obviously under the Doha Declaration, in a case of public health emergency, certain countries can issue compulsory licenses, which is essentially revoking patents. So, isn't that enough? Why do we need this additional waiver?
Yes, that's a good question, Alet. In fact, this has been the argument of quite a few scholars that you have already flexibilities available in the TRIPS agreement, and therefore you do not need these waivers. But I think it's important for us to unpack these flexibilities and understand them and how do they actually work. And these flexibilities work differently for different countries. So if I were to sort of explain my point, I'll take the example of India and let me take the example of another country in Africa. Now, if India wants to make use of these flexibilities, then India can issue a compulsory license on a vaccine which has been patented. And there are several generic manufacturers in India which can then make this vaccine and make it easily available at a cheaper price to people in India. But when you have a country in Africa or in any other part of the world which does not have that kind of manufacturing capability, then for them, the possibility of issuing the compulsory license does not arise, because even if they issue the license, there is no one who can manufacture the drug. Now, this was the problem which was identified in 2001, and Doha Declaration tried to address this problem. But then the real question is that has this problem really been addressed? You have Article 31 bis, which was included in the TRIPS agreement. Now, as per this provision, if a country in Africa which does not have manufacturing capability, they can issue a compulsory license, and likewise a country in India or India can issue a compulsory license, and then India can export those drugs to this African nation. But as India and South Africa have pointed out in their proposal to the WTO, this is an extremely complicated, cumbersome, and burdensome process which has to be followed. So, for example, the country has to notify to the TRIPS Council. There are different coloring, labeling, coding requirements which have to be followed. And there could be an instance where it may not be commercially remunerative or commercially feasible for any manufacturer to produce that drug or produce that vaccine and export it to just one country. So in theory, there is a flexibility available, but in practice, how good that flexibility will work, especially in a situation where we have a global pandemic. I mean, this is not a situation which affects only one country or a set of countries in one part of the world. It's a situation which affects the entire globe. And when you want to vaccinate billions and billions of people, then whether these flexibilities will work, I'm not very sure. So therefore, in a situation such as this, perhaps waiver is really the answer, and the flexibilities may not be sufficient.
And I guess I have two short follow-up questions on that. How do you think we've just mentioned, essentially it boils down to politics. I mean, legally speaking, we have the option to grant a waiver at the WTO. It really depends then on member states reaching such an agreement. The recent changes, the new United States administration, the Biden administration, having a new director general at the WTO, how do you think this will impact these discussions? Because so far they haven't worked. Member states haven't managed to reach an agreement on this. Do you think this will, push this towards agreement on a waiver?
Well, I have good reasons to believe that the Biden administration would be better than the Trump administration, and it would be more responsive to global needs and to concerns of developing countries and of humanity as a whole. Indeed, the appointment of the WTO DG, which was pending for a long time, is a step forward and a promising step. But then we should also keep in mind that at the end of the day, a lot of foreign policy decisions are not so much based on the individual, but are guided by several other factors. And what role those factors would play is definitely important, because let's not forget that US is a leader when it comes to technology and is a house to a large number of companies which have developed these vaccines. And therefore, all those things would definitely play a role. But I hope that the Biden administration would be more responsive to this, and developed world would come and support the Indian and South African proposal for this waiver. I just want to make one more point, Alet, as a compromise, that if, and I speak this completely in my individual capacity, that, if the waiver is quite sweeping, that you cannot waive, say, the entire IP rights or entire patent rights, maybe one option could be that countries settle for a waiver only for Article 31 bis, that they say that as regards compulsory license for those countries which do not have manufacturing capacity, they need not go through this cumbersome, lengthy procedural requirement of notification, coloring, etc. And a country which has manufacturing capability can issue a compulsory license, and under that license, not just produce and manufacture drugs for consumption within the country, but can also export those drugs and vaccines to other countries. I think even if countries can agree to this limited waiver, maybe for a 1 year or a 1.5 year period, that perhaps would be a step forward and could be a good compromise that both sides can look at.
Okay, thank you. I think we'll have to follow the news today and tomorrow to see what is going on in the discussions and what has been. So this is really an ongoing issue, and let's hope they reach agreement that works, to achieve global access, to improve global access. So actually, I'd like to turn to Suri or Martina. You've both been working on these issues. Would you have anything you'd like to add, your perspective on these questions? Of the WTO, of these processes that are happening before the WTO. Suri, Martina?
Maybe I can start and say a few words on that.
Absolutely, go ahead.
So, we perfectly agree that the challenge today is to scale up production. Now that we have safe and efficient vaccines, the issue is really how to increase the production to make them available as fast as possible to as many people as possible. There is another way to do that has not been mentioned yet, and this is the collaborative approach and also the voluntary licensing. So I believe there's already quite a good example of collaboration to scale up production between AstraZeneca and the Serum Institute of India. And this is a good example to build upon also, and to go into a more collaborative way of dealing with this issue. The IP rights can also be considered as absolutely essential for innovation. For a company to enter into R&D, it is important for them to know that the IP rights will be respected. And we have also an interest in pharmaceutical companies entering into R&D and innovating and finding these vaccines. So it is important also that this multilateral framework remains predictable and reliable. So we think that these collaborative approaches that I mentioned before, they will also probably be discussed at WTO, and we're looking forward to the outcome.
Thank you very much, Martina. To you, Suri.
Yes, thank you for the opportunity. I think I would just like to add one element which maybe has not been raised yet, and much of the media coverage has been focusing on, I think, that some of the technical questions, you know, how important are IP rights? To what extent will this actually clear the path towards expanded production? And of course, these are very important questions, and the debate has really evolved quite significantly on that issue, where there is much more widespread agreement today that indeed we have to find ways of scaling up production, and that technology transfers is really essential. I do think that one element that hasn't yet been touched on is, what is this debate about at a higher political level? And I think it's really about how much flexibility is there in these global intellectual property rules when we face a crisis such as the one that we're all in the middle of today. And it's a bigger question than just what specific waivers or flexibilities will help us to get more vaccines for COVID today. I think it's also about how much policy space and how much flexibility is there today, and will there be in the future, when we think about global IP rules and the challenges that countries face. And I do think that being able to demonstrate flexibility will ultimately strengthen the resilience overall of the global set of rules that that govern IP, and also, other public health issues. I think we have to be able to find solutions that work for all countries, and this is beyond the specificities of this pandemic or this one set of technologies.
Thank you very much, Suri. I'd actually like to stay with you, Suri. So what we now see from our discussion is essentially that we really have a spaghetti bowl of arrangements when we look at vaccines. So some countries have bilateral agreements, then we have the multilateral perspective approach, then we have regional agreements, then some countries, some companies are working among themselves. So it's really a huge spaghetti bowl of vaccine supply. Is that a problem, or is that just how it is? Sorry.
Well, I do think it's a problem, and it's a problem going back to, where Lionel started us off on this panel. It's a problem because we don't get vaccines to everyone who needs them, because we're coming out of this pandemic more slowly than is in anyone's self-interest from an economic perspective, not just from a health or a rights perspective. And I do think that it's clear that we arrived, 1 year ago at the start of this pandemic without clear international rules, arrangements, or commitments to ensure access to vaccines or drugs or diagnostics in the event of an epidemic or a pandemic. And I think it's important to recognize a bit of imbalance, I would say, in the global system of rules that we have. And this is why I really appreciate this is the Center for International Law that is convening this discussion, because I think we do have to come back to the question of international law. So we have in TRIPS, we have a set of binding international rules that are intended to promote innovation, right? That is really one of the main objectives. I mean, the other main objective is technology transfer, which is often forgotten. But essentially, IP is supposed to promote invention and innovation. We don't have, on the other side of the coin, we don't have strong, clear, specific rules to ensure access to those innovations. And this has become, very, very blatantly obvious in this crisis. What we have seen in terms of the policy debate is an evolution where people increasingly recognize this. There's just an imbalance in the system. And the short-term solutions are, I think, centered right now at the WTO. What can we do about TRIPS to try to make the system more balanced? But I think in the medium and longer term, we have to think in a much more targeted way. What kinds of rules can we negotiate and construct so that we can share the costs of financing innovation? We can share those risks across countries in a multilateral way, but we can also share the benefits more predictably, more equitably, and more reliably. And I think this is one of the key challenges on the table. I would like to flag that the President of the European Council and other stakeholders, including the Director General of the WHO, have begun speaking about a pandemic treaty. Now, what does that mean? What would go into a pandemic treaty? It remains very, very unclear at this point. But one of the issues that the European Council has put on the table is this question of access to countermeasures, access to vaccines. And so I think we already begin to, and we have to really begin thinking much more concretely, what are the systems of rules, financial commitments, normative commitments that countries need to be able to make in the future so that we're not stuck in the situation of unequal access that we're stuck in today.
So yes, we are at the Center for International Law, and we, in a way, we should perhaps really step back from all our discussions and realize that there is actually no international legal framework on this issue of access to vaccines. So as you mentioned, it's quite fragmented and biased towards one direction. So do you have any sense of what would your ideal framework going forward look like? How would you approach it if we needed it from international perspective? Yeah,
I do think we have a foundation to build on, and that foundation has gotten stronger over the last year. And Covax and CEPI, for example, these are part of the foundation, the political commitment to trying to ensure globally equitable access to vaccines has never been so widely supported or so clearly articulated as it has been in the last year. Now, the operationalization of that is another question, but that political support for the norm of equitable access, I think, is something that we really have to seize and build on. I think the other building blocks, if we look at, what has worked to get us to the point where we are today, where we do have a selection of vaccines that are safe and effective. We had major push funding from governments, and the US is the single largest investor on the R&D side. The European Union and its member states are the second single largest investor, but the third is CEPI, the Coalition for Epidemic Preparedness Innovations. And CEPI is funded by public money. This is a handful of governments who put money into CEPI. They pooled that money together, and it is the largest international research and development fund that exists. And it's a research and development fund that has global access as its mission. And this is different from European Union public money or US government public money. Neither of these other big pots of R&D money have the objective of global access built in. It's a bit of an afterthought. And so the idea that the global community was able to create a R&D fund that has as its objective making sure everybody can get access to vaccines and drugs and other, they focused on vaccines, but you can imagine we can easily extend this to drugs. This is a very, very important precedent. I think we have to build on that. If we look at Covax, that's the other end of the spectrum, right? If we look at the US, Europe, Switzerland, Singapore, all the high-income countries, you're not just pushing R&D, you're also pulling R&D. And Martina mentioned earlier, by putting in place advanced purchase commitments, you make money available for countries to invest in research and development and for companies to invest in manufacturing scale-up. So you're pushing and pulling the system. At the global level, the pull is coming from Covax right now. And we know it's not big enough, it's not strong enough, it can't really quite compete with the big countries yet. But it does create a precedent in terms of, do we have at the international level mechanisms to push and pull the development of products and the manufacturing and the scaling up of manufacturing of products? And we have those elements there. And even just 10, 15 years ago, when we were talking about, an R&D treaty, this idea kind of rose and fell on the global agenda. Neither of these initiatives existed. And we could not imagine, can we have a global R&D fund? Can we have a global procurement mechanism? These were just sort of, ideas that were thrown around. And so I think we've made a lot of progress in the concrete aspects of, how can we try to construct a system? I think the last element that we have seen constructed over the last year is ethical allocation. And this is where the World Health Organization and its expert bodies have played a very important role in trying to actually arrive through ethical deliberation at indeed this question of, when you have a fixed and relatively small piece of the pie, how do you divide up that pie in a way that is ethically acceptable among all the countries in the world? And this is a very, very difficult ethical problem. And this is something that we now have systems for this, we have processes, we have principles. And so the key pieces of the system, I think, are there in their infancy. What's missing is a binding legal commitment, for example, to fund research and development on the part of all countries, and a binding legal commitment to actually purchase, to put money into the transfer of technology, scaling up of manufacturing and purchasing in the end. If we can move closer to such a reliable system, if we can move closer to a system where all countries, for example, contribute to paying for R&D, of course, at different levels according to their levels of wealth and industrialization, I do think we can have much better outcomes in the end and much less conflict in perhaps the next pandemic over the difficult questions that we have to fight over today around ownership of intellectual property, around a pie that is too small, around who will be first in line.
Amazing. And do you have any sense, are discussions already ongoing on this forward looking, or is everyone still very much focused on our current, current fire?
I think understandably, most of the global health community, and in my perception, is still, we're not out of this pandemic yet. And certainly here in Switzerland, we are still very much wrestling with potentially rising numbers of cases again. So I do think that the debates on reforms they're starting, but they are still very nascent. And now is in fact a good moment to begin also broadening the public debate about these questions. And so that's why I'm very happy again to be with all of you and able to explore some of these ideas. It's really just starting.
Absolutely. Lionel, I'd like to turn to you. Would you like to add your thoughts on this question of going forward, how the system should reform itself?
Yes, I don't know if you wanted to deal with some of the human rights aspects of the subject, but maybe if there's time, we can come back to that. In terms of where we are and how we need to go forward on it, I think Suri is right in the sense that really, if we look at the current regime within the WHO, it's fairly limited. There are no obligations pertaining to vaccine access in the international health regulations. In fact, it's not even clear whether it's within the mandate of the WHO to promulgate regulations that would govern vaccine access. And in any event, in terms of enforcement and compliance, the dispute settlement regime is not very strong or compulsory one within the international health regulations. But it is, I think, not unprecedented for the auspices of the WHO to be used as a basis for treaty making. That's happened before in the early 2000s with the Framework Convention on Tobacco Control. And it's my understanding that the proposal by the European Union on a treaty on pandemic preparedness and response is intended to operate on that basis. It's, I think, garnered some interest. Although I think I have to say that it's a bit hard for me to comment in abstract because we haven't actually seen, or I haven't actually seen, the actual text of the treaty proposed. But I think what is clear is there is a sentiment that we really do have to look at what aspects of the existing legal regime need to be changed, drawing on the lessons from the existing pandemic, in order that we may be much better prepared for the next large-scale pandemic that hits us. So in terms of, I think, ideas, I do share, I think, the sentiments that have been expressed by Martina and then Suri, who last spoke, that we do have to think about whether the experience of Covax is something that we can build upon. And I wonder, for example, if the consideration could be given to a more permanent standing framework of some sort, drawing inspiration from the current Covax facility arrangements, so that when the next pandemic strikes, we have something that can be deployed rather than to go around sort of cobbling together an ad hoc arrangement, which we are currently doing with Covax. And while I mean you can scale up a regime such as this when the pandemic strikes in the sort of normal peacetime sort of situation, I think the demand aggregation model idea that everyone sort of pulls together their demands and has an institution negotiate, for example, with the vaccine manufacturers, could be used in the meantime to help developing countries get affordable access to sort of the other diagnostics, other vaccines, other therapeutics. And I think in building this model, one of the things we will need to take into account is really the role of non-government actors. And we've really seen how the private sector players have played a part in the Covax facility. And I think CEPI was just mentioned by Suri as another player who has made a difference here. I think in addition, on the WTO side, I think there will be some scope for reviewing some of the WTO provisions dealing in particular with export restrictions. There's a GATT article on how critical shortages of essential products. And what I have noted is that there is a proposal by a group of countries called the Ottawa Group that does call upon WTO members to review and to eliminate unnecessary existing restrictions on the exports of these essential goods. So I think these are some of the ideas that we should think about. And just as the international health regulations were reviewed, drawing on the experience of many countries after the SARS pandemic. So I think there is some scope for us to think about how we want to do something likewise after this pandemic. Thank you.
Thank you so much, Lionel. I think it's 5:15, so we have two questions. I'd like to turn to these questions. Kwang Gian Leong is asking, are there legal obligations under the Covax initiative for states after they commit to share or donate vaccines? What is the enforcement mechanism? Who would like to address this question? Martina, please go ahead.
So no, there is no legal obligation to share or to donate vaccines through the Covax mechanism. Actually, the Covax facility is currently working on such a platform where this would be possible, but there is no legally binding commitment on that.
Thank you. Yes, Lionel, please go ahead.
I think it's intended to operate not too differently from the commitments that states make with, I think, respect to contributions to the ANC mechanism. But it's not that everything is sort of operating in a sort of legal vacuum. I believe that even if there's a donation of vaccines, there will still probably be a need for the recipient country to enter into some form of legal agreements with, in this case, the vaccine manufacturer in question. And those would be, because I know the question is asking about enforcement mechanisms. They're probably contracts, and therefore enforcement will be dependent on, I suppose, things like the governing law of the contract and the appropriate fora for adjudication of disputes. Thank you.
Yes, absolutely. So domestic mechanisms, but Covax in itself is not a binding mechanism at the international level, but there could be domestic enforcement mechanisms. The second question comes from Brian Chung. He's asking, I think this might be for you, Lionel, as well. Moving forward, would it be feasible for ASEAN to establish a special committee or team to respond to health issues and future pandemics?
I don't know what actually exists even as of now, but I wouldn't be surprised if already there are mechanisms that are available. I mean, I know, for example, that there is a COVID-19 ASEAN Response Fund that already exists. So, and I'm also aware that I think the health ministries of the different ASEAN countries have their own fora for interaction, have their own platforms. And so therefore, I think the answer to your question is yes, it's feasible. The question, I think, is what exactly the activities they engage in.
Suri, you wanted to answer that as well?
Yes, if I could jump in, I mean, certainly I'm no expert on ASEAN, but I do think it's very interesting in this crisis to recognize the very interesting and powerful role that regional bodies have played, in particular the African Union and the European Union. And the African Union has concluded a number of agreements just in the last month or so that will boost their vaccine supply quite significantly. So they will indeed receive quite a lot of vaccines from Covax, but if our numbers are correct, an even larger number of vaccines actually through regional direct agreements with manufacturers. And so the increased negotiating leverage and the funding that's available and the ways that countries can pool risks across regions, I think, has been demonstrated very well by the by both the AU and the EU in terms of being able to secure, to be in a stronger position, I would say, to secure access to vaccines.
Thank you very much, Suri. So we just got another question from Vitor Ido. He asks, thank you for the great panel of remarks. Would you consider that Covax can be seen as a complement or as an opposition to the CTAP initiative, as well as other tech transfer and manufacturing capacity initiatives, including between developing countries such as Sinovac and Butantan in Brazil? Why has a CTAP initiative not gained such attention? Thank you. Suri, would you like to address this?
I think, to be very honest, I think it could be either. I think there could be a complementary relationship, or there could be a competitive relationship. And ultimately, it's in the hands of those who have power to influence the situation. And where does this power sit? It sits with companies, of course, that hold IP and technology, but it also sits in the hands of governments who have funded this, who had funded the development of the technology, who have invested at risk, who are procuring literally tens of billions of dollars worth of vaccines. And so I do think there has not been enough emphasis on technology transfer and on licensing of IP, whether through voluntary means, which is the CTAP initiative is a voluntary patent or IP pool, I should say, or knowledge pool. And I think the failure of stakeholders to really embrace voluntary initiatives, of course, is part of what is driving the move towards taking more compulsory initiatives, as we see in the TRIPS waiver debates. And there's always this direct relationship between the voluntary and the compulsory. If there's more pressure on the compulsory side, you're more likely to get voluntary. If there's more action on the voluntary side, that takes some of the pressure off the compulsory. And I think this is something we've seen for a long time in the access to medicines debate. So I don't think it's predetermined whether the two initiatives are in competition or are more complementary to each other. But I do think that we are increasingly, as I said before, there is an increasing consensus, I believe, that we must scale up manufacturing, and that for many countries in the world, it's not a secure enough position to wait for donations to trickle down, for example, or to, in an uncertain way, as was just pointed out, there's no legal obligation or certainty, or to wait for, unfortunately, a relatively small volume of vaccines to be supplied through Covax. That for many countries, this is not an acceptable position to be in. They want to control more their own, fate, destiny, control over the economies and the well-being of their own citizens. This makes perfect sense. And so I do think the more the global community can identify ways to make that pie, the global pie, bigger, to scale up production, to transfer technology, I think that the better off everybody will be. And just yesterday, there was an interesting summit that concluded where a number of big manufacturers and countries and vaccine developers agreed to this. They said we have to scale up production, and that has not been so clearly agreed upon before as an objective.
Okay, thank you very much. We have here another question regarding the International Pandemic Treaty that the European Union Council is proposing. Would the panelists know if the proposal is to have it negotiated within the WHO, so like the international health regulations, or would it be separate within the United Nations? Have there been any discussions, any specific discussions to this end? Would any of the panelists like to address this? Do we know, or is this just really more kind of a theoretical debate at this stage without any specific suggestions where this would be? Yeah, it's more general. I see Suri nodding.
So I think my colleagues from governments are better placed to address this. What I would say is that from my familiarity with the state of discussions, it's certainly not yet clear, and that there are topics that would naturally fall under WHO because they are clearly health sector topics, but there are a number of topics that do not seem to quite naturally fall under WHO that could be addressed. I mean, access to vaccines is actually a good example of that. Of course, it's a health issue, but it's also an industrial policy issue. It's an intellectual property issue. It stretches far beyond, for many countries, it's ministries of science and technology or education and research that are directly involved in funding R&D. So it stretches beyond the health sector. There are a number of other issues we can consider: travel, tourism, trade, economic, financial stability. I mean, sort of from the environmental sector, this challenge of zoonotic sources of disease and better coordination between human and animal health sectors. I mean, many aspects of pandemic preparedness that really fall outside the traditional borders of the health sector, and this does indeed raise the question of where could such rules be negotiated.
Thank you very much. We have 5 more minutes, and I see that we don't have any further questions. So actually, Lionel, if you wouldn't mind, I'd like to get back, because the one issue we hadn't touched on, which we said we might touch on, is the whole issue of human rights. Whether the existing international frameworks that we have today with the International Covenant on Economic, Cultural, and Social Rights, are these in any way relevant to our discussion today? Can the right to health within that convention give us any kind of guidance with respect to our, to the question that we've been dealing with today?
Oh, thanks. I think there are some provisions that could be relevant within the covenant itself. So you've got, for example, Article 12 of the covenant that deals with the right to health and the right to enjoyment of the highest attainable standard of health. And then you've got Article 15 as well, which talks about the enjoyment of the benefits of scientific progress. I was reminded about this when Suri was telling us about some of the challenges within the WTO regime. I think the real challenge is really a lack of specificity in terms of the sort of concrete binding actions that need to be taken. To to some extent, the Committee on Economic, Social and Cultural Rights has tried to address some of these issues. In fact, last April, I think they issued general comment number 25, which was actually on Article 15, the enjoying the benefits of scientific progress. And I think they were obviously, from the timing of the general comments being issued, I think they were clearly alive to the pandemic-related issues. And so they talked about things like the importance of of scientific progress being accessible to all without discrimination, the need for international cooperation. They do touch a little bit about on IPRs as well, emphasizing that parties have a duty to prevent sort of unreasonably high costs of access to medicines. And they also talk, I think, quite pertinently on things like the importance of the right of access to information on risks and benefits, and also a duty on states to sort of prevent misinformation. And then there was a much more specific, it was not a general comment, but I think it was a statement by the committee at the end of last year on universal and equitable access to vaccines for COVID-19. I think the real challenge is that the general comments and the statements are not really sort of hard norms or sort of binding interpretations of the covenant provisions. So they're much more of sort of a persuasive authority. There are also some questions as to whether, for example, the Article 12 right to health is an obligation that is owed extraterritorially. I mean, having said that, of course, I think if our focus is on intra-state equity, then I think Article 12 might be relevant. But I think the other challenge with the covenant is really the mechanisms for compliance. So there's the usual sort of periodic reporting that you see in the human rights treaties. But these are not exactly sort of binding, they don't really lead to sort of legally binding determinations as such. And while I think the covenant does have an optional protocol that provides for receipt of individual complaints and state complaints as well, the challenge over there is that you have actually, I think, about 170 overstates parties to the covenant. And I think at the last count, at least the last time I checked, I think there were just, 26 that were a state party to the optional protocol. And there are, I think, insofar as the state communications or state complaints mechanism is concerned, I think there are even fewer that have accepted that mechanism. So in other words, I think overall the current sort of landscape seems to suggest that while there are some relevant norms, but there are, I think, limitations in both, I think, scope as well as compliance mechanisms with the covenant. Thanks.
Thank you so much, Lionel. I think our webinar is almost coming to a close. I have to say that I come out optimistic somewhat from our discussion, especially if we think about where the world was at the H1N1 pandemic and where we are today. What becomes quite clear is that there have been positive developments. So we have new governance structures, and it seems that at least now the ethical considerations are receiving more attention, and actually also political currency and financial support is going that way. So it seems like we're in a better position than we were in the past. Still much work to do, quite clearly, both in terms of the legal frameworks, but it seems that we have at least, building on Zoom, it's quite amazing sometimes to think that all of this was largely developed by people working from home and over Zoom, all these constructs, but still we have something to build on for the future. So with that, I'd really like to thank all of the speakers for their excellent contributions. I'd like to thank our audience. And of course, I'd like to thank Jerry Negg here at CIL, who is our events leader and is behind the scenes making all of this possible. A recording of the session is available on our CIL Facebook page and will be available in several days on the CIL website. So I hope you've enjoyed as much as I have, and that you've learned as much as I have, and that you'll join us in future events. So I wish you all a great evening or day wherever you are in the world. Thank you.